So, that answer your question? Any more?
When you talk about Medicare Medicaid,
Yes, I make that mistake all the time.
what is it that they're expanding basically what is it?
Sure.
Medicaid does not allow a lot of things.
Yeah.
What is it that they're going to do that's
Great question. Expansion probably isn't the right word. Basically, by Medicaid expansion, it means expanding the number of people who can qualify for Medicaid. Because right now in Utah, you not only have to be low income, but you have to be pregnant, disabled, senior citizen, a child, or a parent. So you have to be one and the other, a categorical program. Expansion gets rid of those categories. So it says you just have to be low income and you can get Medicaid. It doesn't matter whether you're pregnant or not pregnant or anything like that. You're just in the Medicaid bubble at that point. So that's what the expansion is. In terms of the benefits it provides, there's really no changes to that. The Medicaid expansion is really just about enrollment, just about expanding the categories of people who can get into it. So one thing that Medicaid expansion does do, or it's sort of related to it, is that reimbursement rates for Medicaid have risen for the past couple of years to be on par with Medicare to get more doctors and more providers to accept Medicaid patients. Because that's always one of the challenges. Even if you have Medicaid, there's a lot of doctors that don't accept it. So, because its reimbursement rates are lower than private insurance. So that's one change in sort of the provider side of things. But mostly it's about bringing more people into it. Other questions about it? We'll know within the next couple months what's going to happen. Governor Herbert's going to come out with his budget in December, probably not have Medicaid in it. Legislature meets in January, it's going to be a big issue there. There's some bills that could potentially be run, and so I think by about April, we'll have a lot more knowledge. And if we don't, I'll be a little bit sad, because I've been saying we're going to know a little bit more for the past year, and we never seem to actually get around the corner to see it. But this time, I'm telling you, this time it's going to be there. So we'll find out. Riley's laughing because she's been through this crazy thing as well. Any more questions? Yeah.
So, like, as a take-home message, would you say the Affordable Care Act is a good thing or a bad thing for Utah and Americans? And also, is it a good or bad thing for healthcare professionals?
So, is the Affordable Care Act a good thing or a bad thing? That's really the crux question, isn't it? Okay. I would say the Affordable Care Act depends on your perspective. If you are someone who has never been able to get insurance or afford insurance, if you've been denied because of your health history, then I think it's a good thing, because all of a sudden you're going to be able to get insurance, you're going to be able to afford it, you're going to be able to cover yourself and get the care that you need. But let's say you're one of those groups that got a canceled plan, and you go into the website and you try to shop for new insurance, and you find out you'll be paying much more for your insurance. You're outside of the subsidy bubble, you make too much money to be a subsidy. You were getting insurance for $400 a month and you liked it, and now you've got to pay $700 a month for your insurance. Those people would probably say, boy, Affordable Care Act is not a good thing. Even if it's helping out my neighbor and my friend, and maybe it'll help me out 10 years down the road, it's certainly not a good thing right now. So it really depends on your perspective. If you're a provider, if you're going into the healthcare field, well, if you're in the primary care field, like my wife is, you deal with a lot of patients who are uninsured. And you say, that lump that you got, you probably should get that checked out. But if they can't afford it, then you just wish them good luck and send them on their way, because they can't afford that follow-up that you need. So as a provider, that's probably pretty tough to do that over and over again, realizing that these people just don't have the money to go get these things checked out. If they come in and they have insurance and you can make that referral, sure, they're going to have a copay, they're going to have a deductible, but instead of $10,000, it's going to be $500. There may be something that they could work into their budget. So that, I think, for some providers is going to be helpful. But, for specialists, it could be an up or down thing. I mean, some specialists make more than $250,000. In fact, a lot of them do. So they could be paying more money through their capital gains, high earners taxes. So some people could view that as a negative if you end up paying more taxes, medical device makers and things like that as well. So it depends on your perspective. From a global, or maybe not global, but from a national perspective, the more people who are insured, the more people who have access to primary care doctors and can go and get something checked out early as opposed to waiting for it to get much worse, that's better for the entire system. Because we have a system that says, okay, if you get sick and you have no other options, you can still go to the emergency room and they're going to take care of you. It just happens to be the most expensive place to get taken care of. And we don't leave people to die on the street. That's something we've decided in our country we don't do. So they're going to get taken care of, but it's going to add a heck of a lot of waste and a heck of a lot of inefficiency to our system. So from a national or sort of a macro perspective, getting more people insured, giving them that access to care is probably going to help out the whole system altogether. No matter whether you're an individual winner or loser, based on how you view it in your checkbook or your taxes or your capital gains, globally or macro, it's going to help everybody out. I think. So that was a very political answer, but hopefully it got it across. So, sure. Yeah.
So the people that are in the community are 100% quality or not, they can't even buy over 100.
Oh, they can. They can. They would just have to, they wouldn't get a subsidy. Yeah. So, I mean, like, you know, if you're a 30-year-old, the cheapest silver plan in Weber County is, I think, what did I say, 190 bucks? So if you can swing 190 bucks for that, then a month, or premium, and you make, you know, $10,000 a year or something like that, it's kind of hard to imagine someone doing that, but they could. Maybe they could get help from a parent or something like that, so they could do that. There's also the catastrophic care option. You know, if the insurance, you can buy catastrophic care if you're under age 30, or if the premiums are more than 8, all the other plans are more than 8% of your income. So you can buy that catastrophic care, you know, with the premiums are maybe 60 bucks a month or 70 bucks a month. It doesn't cover a whole lot, but at least gives you, you know, a little bit of financial security. So yeah, you can always go and buy it. It's whether or not you get the subsidy or you don't get the subsidy. The only people who can't go and buy it are undocumented immigrants. They're not allowed to use the marketplace. So, yeah, good question. Sorry. Appreciate you guys teasing out these things that I maybe glossed over a little bit. So, any more questions? Well, I appreciate you guys staying until the end of the show. I'll be around for a couple more minutes if you have any other questions you want to come up, but I appreciate you coming. And any of you guys are interested in primary care and FQHCs, I could also make some contacts for you guys there, you know, here in Midtown or even all over the state. So I'd be glad to do that. And thank you for my host from the, you know, the Pre-Med Society. I know you guys have an official name. It's the American Medical Student Association Weber State Chapter. So thank you guys very much for hosting us and for the departments from also hosting us as well. So, thank you.